Now, vestibular kind of references your balance response, but I want to kind of show you a specific VOR test, vestibular ocular reflex test. Okay, and to test vestibular ocular reflex, what you're going to do is, I'm going to use you obviously, so sit up and sit nice and straight. The way to test it is you're going to have him look either straight at you or at a point behind you. Okay, and what I'm going to do is I'm going to quickly move his head. The vestibular ocular reflex detects that movement in his head through the inner ear and sends the message for the eyes to move in the opposite direction so that they stay fixed on the object that he's looking at. Okay, everybody understand? So if I move my head left, my eyes have to move right in order for me to continue to look at Susan. Right? So it actually is a very quick reflex, and it is really a more direct way to test that vestibular function. Okay? So have him sit there, just look straight at my nose, and I'm going to just go harder and farther. Harder and farther. He's so delicate. And then you can go up and down. Okay, where you move your head up and down. You're looking for the eyes to stay fixed. Okay, so if he's looking at me and I turn his head quickly and I see that, a little jump, or what they call a corrective saccade, then his eye movement is not as rapid as his head movement, and he has a difference. His VOR is not operating correctly. His head is moving faster than his eyes. What's going to happen is that when he's looking at things that are moving, or he's moving his head, everything is going to blur, and he can get dizzy. Okay. Stay focused with it. Right, he can't stay focused, number one. It's not clear, and his perception of movement and what's actually happening, there's going to be a mismatch, and that makes you nauseous, off balance. Okay, so that's the vestibular. We're going to do more with the vestibular, but that's the vestibular ocular reflex. Now, another test that they do for vestibular is balance, because if you don't have an adequate vestibular system, you're not going to have good balance. The problem I have with that is that there's so many other systems involved in that I don't know how you're isolating that just to the vestibular system. But typically a neurologist, like on that website I gave you, they'll have them do the Romberg. Who knows what the Romberg is? Dream of Genie? Okay. So come on over and show everybody.
Didn't we do this earlier today?
Yeah.
During their presentation?
Oh, okay. I'm like, huh?
Oh, okay.
That's sharp rubber.
That's sharpened.
Oh. So it's just
regular size.
Yeah. Okay.
Close your eyes.
So you do with your feet approximated, eyes open for 30 seconds. If they can do eyes open for 30 seconds, then you proceed to eyes closed. Always do eyes open first, because if they can't do eyes open, don't do eyes closed. Just saying.
So
Right?
wait, so is the eyes open considered a Romberg test?
That's
then?
part of it, yeah.
Oh, okay.
It's Romberg, eyes open, Romberg, eyes closed. Sharpen Romberg, eyes open, sharpen Romberg, eyes closed. And the way they write that is EO for eyes open, EC for eyes closed. So yeah, it is part of it. It's just one part of it. So then you look for 30 seconds. Can she hold her balance? Does she have to? What is an indication of a failure of that test?
Stepping, losing balance, opening your eyes.
Following. Right, and that's why I like this position, because as soon as someone does this, they fail. That's how so when someone's doing this and they got their eyes closed, it's hard to tell sometimes, like, okay, what, are they going to catch their balance? But if they're like this and they do this, I know immediately, okay, that's it, they're done. So I like that position with the arms. Okay. Because it makes it very easy and distinct to tell when you're losing the balance. All right, so that's vestibular cochlear. Cochlear is the hearing. Vestibular, you can do the vestibular ocular reflex, looking at sudden movement in the head, making sure the eyes are able to move in the opposite direction. Equal and opposite. Equal and opposite. If it's not equal and opposite, you're going to see a jump. There's going to have to be a catch-up maneuver, which they call a corrective saccade. Okay. So if you see, one direction is fine, the other direction you see this corrective saccade, there's an issue. Okay. All right, that's vestibulocochlear. Glossopharyngeal, you can do the taste in the back 1/3 of the tongue, but really what we're looking for is swallowing. Some phonation can come from this, so if you have someone that you're working with, a stroke patient, and they have known swallowing issues, and you notice that they're always a little hoarse or their voice gets weaker as you're going through the session, it could be some involvement here also. So with the swallowing, I literally will just look. I'm coming on over to you because you look like you want to swallow. So I look in here and ask her, okay, swallow for me. And you're looking for symmetry, right? You're looking for symmetry. So when she swallows, first she ascends and then she descends. So ascends, descends. If you see one side moving and the other side isn't, then there's some paresis on the other side. Okay. Now when you ask someone to swallow on request, it actually is hard. It's like swallow. So give them a minute. Maybe even if they're allowed to have liquids, give them something to drink. It's both. And then you can also test with the gag reflex, which I really don't recommend. And then you can actually have them open their mouth and say ah, and look at their
I did.
And what you're looking for is the uvula should ascend symmetrically and then descend. What you'll see in an abnormal situation is it will deviate. Which way will it deviate? Which way will it deviate?
To the strong side.
Strong side. Okay? Always. With this person. Okay? So that's glossopharyngeal and vagus. Accessory. Manual muscle test. So I'll have her shrug her shoulders up. Hold. Going push. Okay? I can just do, I think that you guys learned the mid-range isometric cervical test, right? Don't let me turn your head, don't let me turn, right?
Yes.
Right? Yes? Isometric, so, don't let me side bend, don't let me push to the side, don't let me turn, don't let me turn. So you can do that, that kind of clears the sternocleidomastoid. Or you can literally put them in that position and try and push them out, right? Okay? And then the last one is the hypoglossal. And that's where you can test. You can do it a couple different ways. If you don't have a tongue depressor, you can have her press her tongue through her cheek, and I can try and push it away. And then the other side, try and push it away. Or I can have her stick her tongue out and watch her move it from one side to the other, or have her stick it out, and I'm going to try and push. Now don't let me push you.
I don't think I was.
Try again. I was trying. Okay, hold it out there straight. Don't let me push you. Maybe I'm pushing too far. That's yeah.
Grade 2.
Okay, let's try the other way. Maybe I'll push
What
it to it.
what does that mean if it's gonna?
Oh my
Got a
God.
weak tongue.
Oh, boy. You don't want to say.
You know what it means, Leah.
Maybe I'm present too far. Yeah, I'm present too far. I don't know. I don't test the tongue a lot. I just like almost rip it out of her head. Okay. All right, and that's hypoglossal. Okay, so it looks like it takes a long time, but people whip through these in like 2 minutes, a minute, 2 minutes. Okay. Look in the eyes. Can you read this? Watch, follow this stick as I move it. Sensation on the face. Motor in the oh, we've got the motor in the face. Facial.
7.
Right.
Smile. 7. Smile.
Like she's
Make your forehead. Raise your eyebrows. Those are both
I think
motor to the face.
I missed
Don't
it.
get
You think you zone out?
okay.
That's
We skipped that one. I don't know why. Probably because I had just this. I never smile. People actually walk up to me and say, "Smile." And I'm like, I am
7
smiling.
has a sensory component too, which is taste on the anterior 2/3 of the tongue. Okay, so don't get facial sensation. When you touch the face, what are you testing? The sensory part of cranial nerve 5. Okay, when you test the muscles of the face, you're getting the motor part of cranial nerve 7. So what's the sensory part of cranial nerve 7?
The anterior 2/3 of the tongue.
Taste on the anterior 2/3 of the tongue.
I have written questions like that on the quiz.
And everybody, at least half the class gets them.
Yep.
That's so easy.
So even though we didn't do it,
Anterior
you still have to know.
and then posterior would be that other one.
Okay, so you guys can practice those, and